Jaya sir, is my voice audible?
Yes sir, audible sir.
Okay. Namaste my dear homeopaths. Welcome to our another session of the class. Today our regular faculty is on leave. Only Suresh Kumar sir and myself are available. Certain points I want to revise of Materia Medica in small, preferably on digestion, stomach oriented. First we will start from Abies canadensis. Abies, A-B-I-E-S, Abies canadensis. This drug is more important for canine hunger. That is too much of hunger will be there. The person going on eating. Tendency to eat anywhere, immediately. There is no time limit. And he likes meat, pickles, radish, purples and whatever not, which is unable to digestible, that all things will be with it. So this person, these symptoms he will have on stomach, he will have canine hunger, too much of hungry, going on eating, tendency to eat far beyond his capacity. He will likes meat, pickles, radish. Because of that one, he will have indigestion, some stomach upsets and stomach pain also. So for this contra will be the Abies nigra. Abies nigra also same vegetable kingdom. Abies canadensis is also vegetable kingdom. This contrast to Abies canadensis. Abies nigra, he will not have any appetite. Even small quantity will make him happy. Pain in stomach immediately after eating. Even small quantity after eating, the pain will come. Whereas pain will be there after eating more beyond his stomach levels. In canadensis, Abies canadensis. In Abies nigra, even after taking small quantity also, he will get the stomach pain. And total loss of appetite. Suppose if he takes a little more in one time, he cannot take the same day another meal also. Like that, Abies nigra will be there. Here, total loss of the appetite, there is Abies canadensis, total hungry will be there. Going on eating beyond his capacity. Where here, he will take a small quantity, after eating immediately, he will get a stomach pain. And Abies nigra is one of the best remedy for esophagitis. The person who are getting esophagus pain, that is termed, we will call it in allopathic way, GERD, G-E-R-D. For that, this Abies nigra is one of the best remedy. Previously I told for the GERD, esophagitis, the pain in the middle of the chest, unable to, uneasy in the middle of the chest. At that time, generally Pan-D or Pan-Did or like that, certain medicines generally we will take. Instead of that one, we are having certain medicines, that is Abies nigra, Argentine nitricum. These two medicines will excellently work on the esophagitis. Preferably after eating anything, if he feels heaviness in the middle of the chest or above the diaphragm, if any pain is there, uneasiness is there, Abies nigra and Argentine nitricum are the best remedy. Here, what we have discussed, Abies canadensis, more hungry will be there, too much of food he will take beyond his capacity. After that only he will get the pain. In Abies nigra, he is total absent of hungry. Little if he takes also, the stomach pain will be there. This is the difference between Abies canadensis, Abies nigra. Next, if you go to another medicine in the same thing, Asafoetida. Asafoetida is also from vegetable kingdom. I think in Hindi they will call it Hind, H-I-N-D, Hind. In routine cooking we use this one very excellently. In our South India, in sambar, rasam, everything they will use this one. This is Asafoetida. Flatulence will be there. Always erectation should be more in this. And sometimes the patient cannot erectate more. Because of that one, he will feel heaviness in the chest area. Heaviness in the stomach. So, flatulence, very troublesome flatulence. Even the gas also expelled with great difficulty. Asafoetida, with great difficulty, the person will have the gas release but through erectations. And this is one of the best remedy for globus hystericus. And next medicine, if you go, Aethusa is there. Aethusa, anybody can tell? Simple point. Aethusa, several times I told only single remedy that. Single symptom only, main symptom. Aethusa is deadly nausea will be there, intolerance of milk. Immediately after taking milk or milk products, he will be vomited or rejected with curdled milk. Preferably we can see in children. After taking milk, immediately the vomiting will be there. For that Aethusa. If it is the repeated vomitings are there, Aethusa is proper medicine. Suppose if it is only because of the stomach trouble or excessive usage of so much of food, at that time we should not give Aethusa. Aethusa, when he, after drinking the milk itself, if he vomits, even adults also, if they take milk, immediately they vomit, Aethusa is one of the best remedy. Like that, even curd or buttermilk or like whatever it may be, milky products, if they don't like, Aethusa is one of the best remedy. And any smell is there after passing the motion or after passing the nausea and this one, if any smell is there, we can use natrum phos also. Because natrum phos, it will make stomach upset very excellently, and the lactic acid imbalance will be cured by natrum phos. So Aethusa natrum phos will work excellently for deathly nausea and immediately vomiting after immediately taking milk. Another Asafoetida I have already told. Another one is that I think you know pretty well Lycopodium, Carbovage and China. I don't want to repeat. Can anybody tell Lycopodium, Carbovage, China? Repeatedly, so many classes we have taken the chapter of Lycopodium, Carbovage, China. All these three things are important for stomach troubles. China is total abdominal dysfunction. If you feel abdomen totally bloated, unable to come backside and front side, gas is unable to release, at that time China will give. If gas has to go upwards, it is not coming properly, its carbonate will give. Carbonate that totally will eradicate the carbon dioxide from the body, and so by that way the oxygen will go inside. And Lycopodium, passing of stools and everything will be proper, and gas will be go down. So Lycopodium downside, China full stomach, Carbovage upper side. Previously several classes I told detailedly, it is a nutshell I am telling, and regarding only stomach. Now we will come to colchicum. Colchicum is also one of the best remedy. I think everybody knows that colchicum is very important for nobody is answering anything. Whether my voice is audible to you or not. On a pin of silent. Hello madam. Jairaj.
Yes sir.
Okay, please get that. Hello.
கேக்குது
யாரு ஆன் சொல்றது யாருன்னு
சவுண்ட் யாரும் இல்லையா?
எனக்கு சவுண்ட் யாரும் சவுண்டும் கேட்கல. சரி, தென் colchicum is one of the
வாய் கேக்குது சார். வாய் கேக்குது.
கேக்குது அப்போ சரி. Colchicum is one of the best remedy for smell. He cannot tolerate any smell of food smell. Suppose anybody is cooking, that smell he cannot tolerate. If anybody tea making, that smell he cannot tolerate. Even coffee also he cannot tolerate. He is unable to tolerate the smell of any food or food cooking. So at that time he will not accept anything. At that time he will feel nausea. At that time we can give colchicum. Colchicum is one of the best remedy for arthritis. rheumatoid arthritis, rheumatism, preferably gout. For gout, this is a primary remedy. I think everybody knows that one. Previously, several classes we have taken on rheumatism and joint pains, everything. This colchicum. Here, as far as stomach is concerned, if the person cannot tolerate the smell of cooking food anywhere, anytime. He cannot tolerate the odor coming from the cooking of food, cooking especially not only vegetables, even egg, fish, meat and also all those things also he cannot tolerate. Burning sensation in the stomach and the abdomen also, colchicum, and abnormal pain will be there in this person whether eating, whether he eats or not, the pain will be there. At that time colchicum will come. Along with this colchicum, we can give colocin. Colocin also one is the best remedy for stomach pains. When pain comes means the person will bend forward. So bending forward will make the person to ameliorate the pain. At that time colocin will work. Remember that one, colocin when it will work, the person when he is having stomach pain, if he bend forward, at that time pain reduces means colocin is the remedy. Like that, diascoria is there. When diascoria, what is the symptom of diascoria? When a person is having a stomach pain, if he bend backwards, amelioration is there, pain is reduced means at that time diascoria will happen. So, along with colchicum, we can give colocin. Only main symptom is when he is bending forward, pain will be reduced. When he is bending backward, pain is reduced with diascoria. Generally, bell and chamomilla are the best remedies for immediate relief of stomach pain. Bell and chamomilla. Put in any type of stomach pain, generally stomach pain will be reduced by bell and chamomilla. 1 or 2 doses if you give, within 3 or 4 hours, it will be settled. So, colchicum, smell cannot be tolerated. Now we will go to lobelia. Lobelia is a rare remedy. I think we have not taken in the class, only in therapeutic time only we have discussed this one. This is a combination of symptoms will be developed in a body, in a system, that respiratory problem and gastric affections put together make him dyspnea, make him unable to breathe, breathlessness will be there. So respiratory problems also there, gastric problems also will be there, and then at that time deathly nausea will be there, unable to breathe properly. Suppose if he take little more of his food, immediately he will have dyspnea. At that time lobelia we have to give. Lobelia generally they will have, please remember, lobelia generally the patient will have respiratory problem along with gastric problem. If he eats more, breathlessness will be there. And if he eats more also, gastric headache will be there. For gastric headache we are having excellent remedy, Irish swell. Gastric headache, if he eats a little more excess, then immediately he will have headache, that is a gastric headache. And another thing, because of eating more, he will get an asthmatic type of respiration. And extreme nausea will be there. Sensation of congestion in the chest, that is also one of the most important. Previously the same thing we have seen in the Avis nigra and as Argentinitica, and lobelia also one of the main symptom is sensation of congestion in the chest, pressure or weight in the chest. If those things are there, lobelia is also one of the best remedy to this one. And next we will go to pulsatilla. Anybody can tell pulsatilla? It's a lady's remedy. Everybody knows that one. When telling the symptoms itself, the person will have, seems to be weeping. Symptoms are ever changing. But
food sorted.
I'm telling in stomach area you come. Before whatever pulsatilla you are having, it's preferably ladies, and one thing pains are wandering here and there, sometimes right side, sometimes left side. And as far as stomach symptoms are there, any heavy food, preferably pastry food or more carbohydrate food, if you feel heaviness in the stomach, pulsatilla is one of the best remedy. Pastry food will not be agreeing in these people, so we have to be very cautious. Pastry food is taken, that is above 50 years, generally we have to curtail, reduce the pastry food and everything. Next, in pulsatilla, what are the symptoms, other symptoms can you tell? If unable to digest the pastry food, these people will have diarrhea. Any diarrhea because of indigestion, pulsatilla is the main remedy. And anything, robelia. Can anybody tell about robelia? Robelia,
For acidity.
the acidity, but what type of acidity will have? Because several classes, several times I have asked robelia.
So reactions we are getting. So
Very good. Next. Robelia raphanus. Anybody? Other persons are not opening except Bharani Babu. Raphanus is very useful for stitching in the liver and spleen area, preferably liver area, stitching pain will be there. It is also one of the best remedy for globus hysteria. Globus hysterical symptom, hysteria. It is more important for chest, middle of the chest, pain is there, argentinating abis nigra, along with raphanus is one of the remedy. These three medicines, abis nigra, argentinating, raphanus are the best remedies for esophagitis. Esophagus problems, anything is there, these three medicines are important. This is also one of the best remedy. The erectations will be very putrid and very noisy will be there, burning in epigastrium area. So raphanus is one of the remedy for them. Then robelia. Robelia is one of the hypochondriac. Hyperchondriac, these two things will be neutralized by robelia. Acrid adaptations will be there in robelia. If you give robelia few days, the stomach enzymes will be proper. The zigzag symptoms of stomach will be reduced by robelia. And heaviness in the stomach, painful stomach, nausea, all these will be reduced by robelia. But robelia, it will not work for acute symptoms, it will work for chronic symptoms. Minimum we have to take 7 days or 10 days. Then any questions from your side? Suresh Kumar sir? Suresh sir? Suresh Kumar sir? Are you ready? You can take. Are you getting sir? Yes.
I want to bring to all our participants and group members. Will continue with our therapeutic index where we left last other day, and with that we'll go into one by one elaborately. And we stopped in the last day class on the disease condition process. And from there we pick up and go to the next disease condition, which is hiccup. Hiccup is a phenomena. It's a spasm. It's an involuntary spasm of the diaphragm, and the respiratory organ gets suddenly choked. Particularly the glottis, epiglottis gets closed. So because of the closure of the epiglottis, we have a phenomenon called hiccup. So for this, what are the first line of remedies? And these are for hiccup, we have Max Moschata. Max Moss is the remedy. Then we have Retania. Then we have sulfuric acid. Then Secojabulosa. Then we have Lycopodium. Also the Ignatia. So these are the 5-6 remedies which are the first line of defense remedies for the situation, condition, hiccup. So I repeat that nuts, moisture, Retania, then sulfuric acid, and Secojabulosa, Lycopodium, and Ignatia. Then the next disease condition is your hysteria. What is this phenomena? Hysteria. It's a state of the extreme fear, or we can say extreme panic that cannot be controlled. It's a state of extreme fear or extreme panic that cannot be controlled, or otherwise we can also call it as a marked excitability resulting into disturbance of sensory organs, then vasomotor organs, and visceral functions also. So it is a psychogenic phenomenon. So it is there is a marked excitability with disturbance of the sensory organs. There is a vasomotor disturbance, and also maybe accompanied with visceral functions also. So in such a situation, in hysteria, what are the first line of drugs for the physician? We have Ignatia, we have again Platina, we have Max Moschata, then Belladonna, then Valeriana, and then Asafoetida. So these are some of the first line of remedies which we think of in the condition of hysteria. So I repeat the drugs: Ignatia, Platina, Max Moschata, Belladonna, and Valeriana, and Asafoetida. Majority of the cases in hysteria, we can easily get rid of this motion aspect from Ignatia and Belladonna. They are very handy in clinical conditions. Both Ignatia and Belladonna are very handy, so we can think of these remedies. But in extreme situations of hysteria, we can think of always Platina and Valeriana. So these are some of the first line of remedies we can fall back on this condition. The next thing to say is this disease condition is your impotency. Impotency, we have drugs, acid frost, then we have agentamidine, Euroimmun, very a new drug for all of the participant in the Euroimmun, and then we can lycopodium, caladium, and selenium. Selenium is also, it comes in the metal group of classification. So these are some primary ways we can think of always in case of impotency. So always lycopodium comes as a primary way, remember, apart from other remedies. So I repeat, for impotency we can choose phosphoric acid, argentum nitrogen, then your lycopodium, yohidium, caladium, and selenium. So these are some of the first line of defense remedies for your condition impotency. The next disease condition is your influenza. What is influenza? It is also known as, otherwise known as flu. Influenza is also known as flu. So it is a very common viral infection, part in the nose, part in the throat and lungs, and also it is exhibited externally in the form of fever, body ache, and running nose, discharge from the nasal tract, sore throat, accompanied with cough, and headache, and then fatigueness also. So these are the associated symptoms in case of the influenza, or otherwise we call it a flu. So in the viral influence, very commonly found in our clinical conditions. Predominantly it is commonly found in case of children, and more often with school going children. That is, I have done many of this influenza or the flu with the children, because in school if one child is affected, automatically this flu is being transmitted to the next child. So it is a very common infectious phenomena with the school going children. So, and often we come across with this in particular those children, those people who are lacking the immunity. So if the child is lacking immunity, then frequently it is prone to this kind of phenomena, viral infection of flu. So flu is exhibited in the form of fever, body ache, running nose, sore throat, cough, headaches, and extreme fatigueness accompanied with that. So what are the remedies we can think of in case of flu or influenza? So first we can very easily think of some of the prime remedy, the arsenic alba. Very commonly goes in our mind, arsenic alba. Then we can think of also Samalia, and next we can think of Dicamba also, because Dicamba has got a seasonal fluctuations because of the weather changes, the Dicamba takes care of. So any seasonal changes, weather changes, then Dicamba calls in, and then we have got Gelsemium. Gelsemium was got, is a very good polygus. It is meant for fever, it is meant for the nebulizer, it is meant for the body ache also, and it is meant for also your cough also. So Gelsemium is a polygus we can think of always, and then we can think of in case of Eupatorium perfoliatum also, because it has got his headache, it has got a body pain, it has got the fever, it has got the limb weakness, extreme fatigueness also. So we can think of Eupatorium perfoliatum also in case of viral infection of flu. So I repeat, drugs we can depend upon Gelsemium, we can think of Ignatia, we can think of Eupatorium, sorry, we can think of acetic album, we can think of euphorbia, then we can think of Sapodilla and Alcantara. And of course, I forgot to tell, we can add to the list as rust stocks also. Don't forget rust stocks. Rust stocks also can be thought of in case of influenza and flu-like situation, because rust stocks also has body pain, headache, extremities pain, backache, all the things, because it has got also, it can be prescribed for seasonal fluctuations also. So we can think of also rest stocks also in flu-like situation. So these are all the remedies we can think of for the flu. Then coming to next disease condition, insomnia. Insomnia is very commonly we can define as a sleep disorder. It's a sleep disorder. One may have trouble in falling asleep and staying asleep, or both together, or difficulty in getting a good quality sleep also. This all falls under the category of insomnia. So that is trouble in getting sleep, falling into the sleep, then prolonged staying asleep, or having both, and not getting a good quality sleep also. All it includes insomnia. So for insomnia, what are the drugs also? We can think of, for insomnia, we can think of chamomile, where there is much turbulence and emotional upsets are there, and there is a stress and tensions are there. We can think of chamomile, and we can also emotional state when disturbed. We can think of ignatia also, and we can think of ophia, then nux vomica, because of any digestive disturbances occurring and sleep disorders created. So GI tract disturbances leading to insomnia, nux vomica. Then we can think of passiflora, and we can also go for pulsatilla also. Don't forget the pulsatilla, very good remedy for insomnia also. Very rarely we use it, but pulsatilla is also very good remedy, because whenever there is a fatty intake of the food is there, then we have got a sleep disorder. So that is the fatty food indigestion will be solved by the pulsatilla. So pulsatilla is also very handy in such situation, and we can take all these remedies as a first line of remedies for your insomnia. Then from bio point of view, bioexalt also, I have on many occasions I have tried and found very useful Califos also. And Califos tablets are very good in inducing sleep. So in particularly in geriatric patients and people, aged people, senior citizens, they have got erratic sleep and sleep disorders. We can always support with Califos, which induces sleep. So for insomnia, we can, I again repeat the drugs. We can think of coffea, we can think of ignatia, chamomile, nux vomica, pulsatilla, passiflora, as well as Califos also. So these are the remedies we can for this type of disorder. Then next is intermittent fever. What is intermittent fever? It is a fever that spikes and then returns to normal. Intermittent fever is it will get spiked up and then it returns normalcy in cyclical pattern. That is very important. And in ultimate it falls to normalcy each day. So there is a cyclical phenomenon involved in intermittent fever, like malaria. Very excellent example is for intermittent fever is malaria fever, that the fever spikes up and goes, and then finally it remits back to normalcy. So such type of fever is known as intermittent fever. So what are the remedies for intermittent fever? So all of us know one remedy very easily we can prescribe. Anyone can say what are the first remedy which they can think of for intermittent fever?
Answering
I'm taking this one, but the first line of remedy which always we think of is China. That is specifically meant for your intermittent fever. So China, or otherwise is known as Synchrona bark. Okay, so or Peruvian bark. These are alternates for that. So China is a very prominent remedy for intermittent fever, and then we can take arsenic alcohol. That is also called for the intermittent fever also. So China, arsenic alcohol, and next very important remedy for intermittent fever is your natural muriaticum. Okay, we know that natural muriaticum fever, as the sun set. Now, what is the modality in natural mode? Natural mode modality is as the sun set, so as the sun rises, there will be aggravation, and as it goes towards the sunset, the amelioration happens. So this is the natural mode phenomena. So that's why it has got an intermittent type of phenomena involved in natural mode. So natural mode can be thought of. We can think of Gelsemium also, or primarily. Then we can think of Ipecac, and we can also think of Capsicum also. So capsicum is one of the finest polycrystalline also. Very rarely used, not frequently used, but it can be also thought of in case of necessity and need. So for intermittent fever, we can always fall back on China, and we can fall back on arsenic alcohol, Gelsemium, natural muriaticum, Ipecac, and then Capsicum. So these are some of the first line remedies we can fall back on for the situation intermittent fever. Then next important is iritis. Iritis is related to your problem related to eye. And in iritis, there is a swelling and inflammation of the what is called around the eye pupil. So which is called iris. The eye pupil is called iris. Around the iris, we have a colored ray. A sort of ring formation happens, and it is exhibited in the form of inflammatory manifestation, and there is a swelling also observed around the eyes pupil. So iritis is inflammation of the iris. So what are the remedies we can think of such situation? So first, easily we can think of for eye euphrasia. All of us know is a prime remedy to for eye euphrasia. Apart from euphrasia, we can fall back on belladonna. Then we can think of mud salt. Then we can go for clematis, and we can go for symphytum also. All of us know symphytum is a trauma remedy, injury remedy. Okay, symphytum is predominantly used for sir. Anyone can pose?
For bone injury, sir. For bone injury.
Yeah, bone injury, particularly bone fracture.
grinding hormone.
It promotes bone union. In case of fracture, the symphytum has got formation of calcium around the fracture spot, callus formation, and union is being formed between the two breaks of the bone. So, symphytum is not only the injury, it is called for in many other circumstances also. So, one of the circumstances is your iritis. For iritis, we can use it symphytum also. So, we can, I repeat the drugs. For iritis, we can fall back euphrasia, which is the primary 5. We can think of belladonna. We can think of ginseng, Noxol. We can think of clematis, and we can fall back on symphytum also. So these are some of the first line defense remedies for the given situation, iritis. Then coming to injury, many times this has been taken by our own faculties. Okay, I need not have to elaborate on this, but still, whenever there is an injury or any kind of trauma, what are the remedies we can think of? And in some, we can go with first, always we go for arnica. Why? Because for circulatory disorder to be corrected. Any confusions, whenever there is a hematoma or like any confusion happens, then bruises like that, in such situation, arnica is called. Remember, arnica is never applied in open wounds. For open wounds, we have calendula. There is a difference. Arnica is for the closed wound, that is clotted formation, bruise, filling, and hematoma-like situation, and we can, for open wounds, lacerated wound be called. Whenever there is a lacerated wound is there, we fall back on calendula. Then, coming to when there is an injury to bone, we have got what are the remedies? Injury to bone, we have got two remedies, Rustox and Rustox and Ruta. Yes, for the bony pain, we can always go for the Ruta and Rustox. Of course, Rustox takes care of muscular level. Mainly, it is Rustox has got impact on the muscle level. So, but still, we can think of in case of injury, deeper injuries, Rustox as well as Ruta both. Then, whenever there is an injury to the nerves, whether it is a peripheral nerve or non-peripheral nerve, but whenever there is a deeper injury, definitely nerves are affected, basically. And when nerves are affected, we have to tackle with them also. So, for dealing with the nerves, we have got a given remedy, hypericum. Hypericum is even the crushing of the finger can be taken care of by the remedy called hypericum. So, hypericum is called for the nerves. Then we have got another injury remedy for muscles. I told Rustox, and we can, for deeper injuries and for deep internal injuries, we can think of also Bellis paralysis, very important remedy. When deep injury happens, any kind of deep injury happens, we support with Bellis paralysis also. So, and then we can also think of injury remedy as a Ledem also. Okay, Ledem is excellent remedy for deeper injuries also. And this Ledem is in our army, it is anti-tetanus. Okay, whenever we are injured, whenever we have got injury, we go to hospital and take a first aid, is it not? The injection. What is the injection, sir? Anti-tetanus. No one can say. Antitetanus injection we going to take. In that place, we can use leaden tar as antitetanus remedy. So for deeper injuries, the leaden can be thought of always. And these are all the, I have listed some of the important primary remedies for the injury. So I repeat, arnica, hypericum, Rustox, ruta, leaden, calendula, and belly sperm, and symphytum also. And we can, in case of bone injury, we can also support with calcareous force also. Any deeper tissue injury is there, then we can also always support with bios also, calcareous force also. So I have listed on the trauma remedies or injury remedies we call it. So this we have to keep in our mind always, because every time any injury can happen, and we have to give first aid to the patient in our clinic, and if it can be handled by a government, we can handle it. But if any injury, deeper injuries where there is blood loss, heavy blood loss is there, please don't treat it. I request, don't treat when there is a heavy blood loss is there. You can put a gauze and bandage etc. transport him quickly to the hospital. And wherever open wounds are there, whenever there is a we have to put sutures. Okay, it is more than 1 inch. Whenever there is a cuts of more than 1 inch, please don't handle it. Take it to the hospital. Have a suture done immediately. So there are certain circumstances of injury we can, particularly fractures. And whenever there is a fracture, please take the patient to the hospital. Refer it to the hospital. Don't delay. You can put slings for preventing the more damage to the bones and bone tissues. You can put the slings if you know the first aid. Okay, there is a book by St. John's Ambulance. There is a small book, first aid book by St. John's Ambulance. They are giving very good book for first aid. In different situations, traumatic situations, what first aid we can give, and we can take the patient to the hospital immediately without causing any delay. So that book is very handy. In that book, how to put sling when there is a fracture to the arms, when the lower extremities, when there is a fracture, when there is ankle fracture, when there is a rib fracture, when there is a shoulder fracture. Then what are the slings, what are the type of slings we can put it so that we can safely transport the patient to the hospital. So such type of first aid informations are there. If we learn in the clinics, we can put the sling and we can put a tape or something like that and cuff it and send the patient to hospital. So I always request all our doctors at the clinic, don't handle critical don't invite any kind of risk by handling critical patients, particularly deep injuries, deeper accidents, etc. Particularly burns also. Please don't handle burns which is of second degree or third degree. If it is a first degree burn, you can handle. Again, I repeat, you have to know what is first degree burn, what is second degree burn, what is third degree burn. So if you know this, then only you can handle the burns. So if there is a small burn, then we can easily handle. But when there is a second degree burn, or when there is particularly third degree burn, please immediately transport the patient to the hospital. Never handle yourself. So that will invite you more risks and more troubles. So let us handle smaller injuries, smaller accidental things, and wherever surgical approach is required, wherever surgical interventions are required, please transport the patient to the hospital. Don't handle. You can give the patient medicine after the patient is discharged from hospital, support him as a complementary way, but don't handle immediately, send the patient to hospital, at least in hospital, immediate attention to that, we can take the x-rays, etc., find out the fault, and rectification is possible immediately, and we can save the patient at the earliest. So, for injuries, because I have done many times where I have to handle some of minor injuries also, some of major injuries also. So, whenever the major injuries comes, then please try to understand and send the patient to the hospital. So, you have to decide yourself. So, I repeat, injury remedies again: arnica, arnica, hypericum ledum, calendula, symphytum, rubra, rustox, and bellisco. So these are the remedy. Then next in seizure is a disease called jaundice. Jaundice is all of us, let's be very clear. Jaundice is not a disease. Okay, jaundice is a symptom. Okay, jaundice is a symptom. It is reflected in the form of yellow coloration of the skin caused by the buildup of bilirubin in the blood. It is basically on account of the formation of the excess bilirubin in the blood and causing yellow discoloration of the skin. And we have to understand the underlying cause, identify the underlying cause for the jaundice. Okay, and the causes may be, I list down the causes for this. It may be hepatitis. It may be, there are different hepatitis also. We'll go into disease when we discuss a lot about this. There is hepatitis A, hepatitis B, hepatitis C, and like that. So, on account of the hepatitis, jaundice phenomena may result in. Then, if there is a gallstone obstructions are there, then on account of gallstone obstruction disease, jaundice may develop. When there is a gallbladder or pancreatic cancer is there, then jaundice can manifest. When there is a liver cirrhosis is there, jaundice can happen. Jaundice is an associated symptom of the cirrhosis. Then, when in anemia, particularly hemolytic anemia, there is different kinds of anemia there. I will take when we go to pathology. Mostly shortly planning after finishing the organ, we will go to pathology. When we go to pathology, we will vividly see what are the various kinds of disease are there. Then we will go to the different anemias are there. So one of the types of anemia is your hemolytic anemia. So these are some of the causes which leads to jaundice exhibition. That is, jaundice is observed in case of hepatitis, gallstone obstructions, gallbladder obstructions, and then gallbladder and pancreatic cancer, carcinoma, cirrhosis of the liver, and hemolytic anemia. So, jaundice has, what are the primary remedies in our armory for jaundice? So, for jaundice, we have got very good remedies. We can deal it like we have got the finest remedies, chelidonium. Chelidonium is a prime legal remedy. Then we have got lyco. Lyco and chelidonium are prime remedies for a given situation. Then we have got chilium sulph. This is also one of the prime remedies. Apart from this, we have to think of natron phos also. We can go for Maxol also. We can go for Codophyllum also. We can think of Bryonia also. In jaundice, even bryonia can be called for. So bryonia is one of the beautiful polygas family. So I listed down some of the prime remedies, first line remedies, your chelidonium, lycopodium, chilium salt, and natrum phos, mud salt, and bryonia and podophylla. So those are some of the primary ways we can always think for the jaundice situation. Okay, I want to highlight you because how it can be misleading. Recently I had a case of jaundice when when the patient came to me, the bilirubin was very high, very high. Okay, very high, and I gave the medicine, all jaundice medicine. I was monitoring. Fourth day, bilirubin did not come down. Bilirubin did not come down. Then I continued 2 more days, 3 more days. Say 7 days. Even 7th day, bilirubin did not come down. Then I had a suspicion. So when I saw, immediately I subjected the patient to the ultrasound abdomen I subjected it, and when the ultrasound reports came down, it was surprised that it was a gallbladder obstruction along with pancreatic duct obstruction both together, and patient was having cancer background. On account of cancer, metastasis happened and it has blocked the gallbladder path, gallbladder duct. It has blocked the, it has also blocked your pancreatic duct also. So immediately on the 7th day, I subjected the patient to the hospital. So you have to go for underlying cause. Please, whenever jaundice etc. comes, we have to go therapeutic indication along with pathology. Always remember, we go along with pathology. When on one hand, you keep the pathological investigation report and then start treating. And when the treating, have a frequent assessment of the status and condition of the health of the patient with the frequent assessment of the pathological report also. Okay, so we cannot blindly prescribe that okay, it's a common hepatitis, because always whenever jaundice happens, then we think that it's a common hepatitis A, and normally hepatitis A it is occurs to many people, commonly hostels, colleges, etc. in a mass level. In such situations, it can be dealt very easily. But why I said we have to always understand where the pathology is existing and what has led to the jaundice situation. So when the bilirubin is not coming down by our medicines, please go for pathological investigation immediately, and a frequent evaluation of the pathology is mandatory. So this you have to think of. So I repeat, jaundice is a symptom, not disease. Okay, with that we go to next disease condition, kidney affections, or other way to kidney infection. So the infection, maybe I'm not going into nephritis, etc. Commonly caused by the bacterial infection or any viral load. The inflammation of the kidney caused by the bacterial load or the viral load. So this initially begins as a bladder inflammation, and from the bladder the infection moves upwards and it moves upstream to infect one kidney or both the kidneys also. So the infection initially begins in the bladder, and from bladder it can travel upwards either to one kidney or both the kidneys. So these are the inflammatory situation of the kidney. So kidney infection still, what are the important prime remedies we can think of? So for kidney affections, we have got prime remedy Cantharids, no doubt about it, and always we can think of Apis also. Apis and Cantharids are the prime remedies. Then I am not bringing it here Barberis vulgaris. Okay, I am not bringing here Barberis vulgaris, but I am bringing here for kidney infections Cantharids and Apis, along with that arsenic album. Very powerful potent remedy for kidney. Arsenic album, for any viral load or any bacterial infection, we can always depend upon the arsenic album. Arsenic, because arsenic album has potential to kill the bacteria and virus, etc. So always we can think of Cantharids, Apis, arsenic album, and then phosphorus, causticum, hepacel, and spongia. These are some of the prime remedies. So I repeat, for kidney infections or inflammation of kidneys on account of viral load or any kind of bacterial infection, Cantharids, Apis, arsenic album, hepacels, phosphorus, causticum, and spongia also. But in case of very early situation also, we can take aquamine also, because any suddenness of the disease, aquamine can be called for. Any first stage of inflammation, first stage of spontaneous repercussion or exhibition of the manifestation of the acute phase of the disease, we can always think of acute class of remedy, aquamine. Aquamine is very handy. You can use it at a very first instance. So we can think of also inflammatory for aquamine also. So I have given the list of remedies for the kidney affections. Then coming to next disease condition, it is leukorrhea. Leukorrhea is a phenomenon with female group of people, and it is known as white discharge in females. That may be normal, or it may be on account of some infection. Namely, the infection may be because of Candida albicans, very commonly found. If you do the analysis, pathological investigation, infection is very commonly found with Candida albicans. It is a yeast actually, and otherwise it is known as fungal infection. And another infective organism which is cause for the leukorrhea is your Trichomonas vaginalis. Trichomonas vaginalis is a parasite. It falls under the category of parasite. And next, another infecting organism is bacterial vaginosis. This is bacteria. So three type of infections can be seen in case of infection, and then leukorrhea phenomena, leading to leukorrhea phenomena. So one is fungal infection on account of Candida albicans, the other is parasitical influence on account of Trichomonas vaginalis, and third is bacterial influence on account of bacterial vaginosis. So on account of this infection, there may be extraordinary discharge, unusual discharge of infection. So leukorrhea, what are the remedies? These have been many times being taken by our doctors, and What are the prime remedies? 3 prime remedies are called for apart from the Pulsatilla sepia. Pulsatilla sepia is a very common remedy we use as a women remedy. Both Pulsatilla and sepia are the prime women remedies, no doubt. We can think of in Liporia. But apart from Pulsatilla and sepia, what are the other remedies we can follow? The next is borax. Borax is one of the excellent remedy for Liporia. I have tried in many women, borax, and I have been very successful also. So, borax, then aluminum, then crozodum, and calcareous carb. So these are the other primary remedies we can think of. So in case of chronic Liporia etc., calcareous carb is definitely called for because it is a constitutional remedy and we have to intervene with calcareous carb. So we can always keep in mind the calcareous carb as a constitutional remedy for Liporia. So I repeat, Pulsatilla sepia, calcareous carb, then borax, crozodum,
I might say.
So, with this last in this series, I will stop. The other disease condition is lumbago. What is lumbago? The last for today's class, lumbago is a low back pain. All of us know. It's a low back pain involving muscle, nerves, and it's a back pain predominantly, and it's caused by injury to muscles on account of the strain, and it is injury to ligaments that is exhibited in the form of sprains, and common causes are mainly lifting heavy weights, poor posture, lack of regular exercises, then fractures, then herniated discs, ruptured disc, and arthritis. These are some of the underlying causes for the lumbago back pain. I repeat, injury to the muscles, injury to the ligaments, and then improper lifting, postures also, sitting postures, lack of your regular exercises, and fractures, and ruptured disc or herniated disc or arthritis. These are the underlying causes for lumbago. For lumbago, we can think of always Rustox is one of the finest remedies for lumbago, and arnica. Both are finest remedies. Arnica and lumbago will work on the back very well, on the spinal level. Then we can think of Calicar. Then we can think of Phytolacca. We can think of Sinusifuga. Then we can think of Phytolacca. And don't forget sulfur also as a constitutional remedy. Sulfur has got also back pain also. So as a constitutional remedy, we can prescribe sulfur also for early cure, pain cure. So I repeat, for the lumbago, we have Rustox, we have arnica, we have Calicar, we have got Phytolacca, Sinusifuga, and we have sulfur, also Hyoscyamus. Hyoscyamus also can be thought of in case of back pain also. So these are some of the first kind of prime remedies for lumbago. With this, I give pause to my class today. We will continue with more disease conditions and the therapeutic references in our next class. Over to Dr. Murthy.
Thank you, sir, Suresh Kumar sir. Totally have taken a lot of therapeutic points. Thank you very much. I think today time is over. We will take leave from you. Next week we will meet. Okay, sir?
Okay.